All right, guys, we're going to talk about the hip hinge, which is your first global movement pattern. All a hip hinge is a bend and a lift, okay? But our main focus here is we want that hip hinge to occur at the hip joint. So where our femur comes into the pelvis is the hip joint, okay? Then we've got this pelvic motion that can occur here as well, and that's what we want to stabilize. Okay, so we want this lumbar and pelvic spine area to be stable so that the motion occurs strictly at this hip joint, okay? As opposed to some type of excessive pelvic tilt bringing lumbar extension there, or excessive posterior pelvic tilt bringing lumbar flexion. Remember, and that's so that we can load the spine in a nice capacity that the body was designed to do. Okay, so how you're going to do this is you're going to grab a dowel, okay, and we are going to place this dowel on our back so that we can touch three spots: our sacrum, our thoracic spine, and the back of our neck. Okay, if you are somebody who is having trouble getting all three of those spots to touch, it's likely because we have a little bit too much flexion here through our thoracic spine. Remember, thoracic spine extension mobility techniques will help you out. So if that's the case, I just want you to drop the neck. Don't worry about the neck for now and just focus here on the lumbar spine and the pelvis, okay? So these two spots, mid-back touching, sacrum touching, okay? We're gonna start off with the pelvic tilt. We're gonna tilt forward. Understand that position, feel that position. Tuck, back. Understand that position, feel that position, okay? We're gonna then find a nice kind of neutral. And remember, for a lot of you, it's going to feel much closer to the posterior tilt because we are living here in this anterior tilt, and that's the new normal your brain has found. So we got to train that out, okay? So find neutral, and I'm just going to work on hinging and trying to maintain this gap here with my left hand in between my back and the dowel. We want that gap to remain the exact same as we hinge, okay? As opposed to letting it change. So if the pelvis were to tilt forward, okay, see how I have a much bigger gap now. My thoracic spine is no longer touching, okay? My pelvis tilted forward as I bent, okay? The opposite way would be if I were to hinge back and now I'm tucking through the pelvis. I'm losing this sacrum contact and now I'm bending here through the spine, okay? In both of those orientations, the hip musculature can't actively control and produce hip extension. Okay? Instead, we're getting a lot of that through the spine. Okay? So here, back to neutral is happening through my back. From here, I'm excessively flexed through my back. My glutes aren't loaded as efficiently as they could be. That also is putting excessive strain through the spine. Okay? So practice that. We're going to have a slight bend here to the knees. So if you can see that, slight bend as I hinge, okay? Goal is to get those hips back. If your hips do not go back, your spine will have to bend. So sometimes it's effective to have some kind of an object behind you so that you can hinge and touch and understand and get feedback that your hips are moving back, okay? So what I want you to focus on though for this, because a lot of us struggle with anterior pelvic tilt, we're going to focus on a nice strong core engagement, just like you were doing a plank or a dead bug, one of those correctives, as you hinge down, okay? As you hinge up, same thing, that's going to help control the pelvis. Then focus on the glutes, tightening and pushing your hips forward, okay? If you can actively feel all those muscles, you're doing a great job. When you get better and better at this, you're going to get rid of your dowel, and you're going to try to learn how to hinge without that feedback, okay? Now the last thing to take note is mobility restriction here through the posterior chain. If my hamstrings are tight and I go to hinge and I run out of capacity for them to lengthen, the only way I can get down further is by bending through my spine or tucking, which shortens the hamstring length to allow me to bend further. But remember, that then is coming from spinal motion, not from hip motion, okay? It's going to excessively load those discs, especially if you're lifting something heavy. Okay, can be very detrimental. So we're just going to work in your pure range of motion that you can control. That will get better and better as you improve your mobility and improve your active control over the trunk. Okay? So give that one a shot.